welcome back. We're going to start our next panel. For those I haven't met, I'm Mike Lyons. I'm one of the co-chairs of this committee, and I'm really excited for this panel focused on public policy and its implications for digital technology and youth mental health. So I'm going to turn it over to the panelists and the moderator, Brooke Lehman, to introduce themselves and kick off this discussion.
Good morning, everyone, and welcome to what I understand is the final panel of what's been a day and a half long fascinating symposium. I'm Brooke Lehman. I'm going to serve as the moderator, so it's really just keeping things going. The goal for today is to hear from these tremendous experts on how mental health is being impacted by the digital age that we find ourselves in, and most importantly, what policy can do and what it has done to impact this subject matter. So I'm going to turn it over to the panelists to introduce themselves first.
I have the great honor of going first. Hi, everyone. My name is Lakeisha Steele. I'm the Vice President of Policy at the Collaborative for Academic and Social Emotional Learning, everyone's favorite topic, in addition to mental health these days. I come into the space after being at the federal level for about 10 years, essentially leading K-12 education policy. And so it was a very full circle moment to actually be working on legislation on this side to advance policies to support students' social, academic, and mental health. And so after working on the American Rescue Plan Act, which was this unprecedented investment in our education system for the first time in our country, the federal government really gave students what they deserve. And so it's been exciting to see school districts. McKinsey just released a report this week that shows that a number of those investments, of those American Rescue Plan ESSER dollars, went to academic recovery, but also responding to students' mental health and social emotional needs. And so when I think about the role of social emotional learning and mental health, it's really from a prevention and a promotion strategy, really looking at what the research says around the importance of positive and caring relationships, safe and supportive environments, and social emotional skill development that actually creates these protective factors to reduce mental health challenges. And so it's really exciting to be here and to be thinking of new ways of creating an infrastructure particularly within our education system that reaches 50 million of our students. 90% of our students are in our education system, many of them low income, students of color, and thinking about how to navigate the current challenges that we're experiencing, living through a digital era, and how policies have to evolve to support our youth.
I think we get to share.
Oh yes, sorry.
Good morning, everybody. I'm Vale Wright. I'm a counseling psychologist by training, and I'm the Senior Director in the Office of Healthcare Innovation at the American Psychological Association, which is the largest nonprofit membership association representing over 159,000 psychologists and students and those interested in psychology. Our office really does focus on the role of technology and data within healthcare, particularly mental and behavioral healthcare, through the lens of this idea that we really cannot address this mental health crisis if we keep doing things the way we've always done them, which is this sort of single model of care, right? Face-to-face or now telehealth, a 45-minute, individual, maybe group psychotherapy that happens on a weekly basis that maybe gets paid for by insurance and maybe not. It works for a lot of people, but it doesn't work for everybody for all the reasons that you've heard the earlier panel talk about, right? And so we need to think more innovatively, and we need to support the workforce and expand the workforce, but we need to think about prevention. We need to be thinking about integrated care. We need to be thinking about single session, and technology is clearly going to play a huge role in what we do going forward. So how do we ensure that technology, which may include AI or VR or other things that we're seeing, is safe, effective, responsible, and ethical? And how do we approach that from a policy perspective, from a regulation perspective that is effective? And I think it requires partnership. So a lot of the work that we do at APA is working with both our federal partners, in particular the Centers for Medicare and Medicaid Services. And you may be thinking to yourself, what does Medicare have to do with kids? A lot. Because what CMS does, the policies that they set often get adopted by commercial payers. So it's a critical place where we need to make sure we get it right so that there aren't unintended consequences going forward. We also do a lot of work with the Food and Drug Administration and their regulation and how they evaluate many of these digital tools, ensuring that subject matter experts in mental health are at these tables, because often they're not. They are often led by medicine, which may be well-intended, but may not understand the important nuances that exist within behavioral health care and the crises that individuals are experiencing. We also work with industry and with other coalition groups in the space like AdvaMed or the Digital Therapeutics Alliance, the Society for Digital Mental Health, because if we can bring all the voices together in alignment around the things that we agree on, I think we can have more powerful impacts at the end of the day. And not just at the federal level, but at the state level as well. So you may or may not know that every state and territory has a state psychological association. And so they are the ones really working at the state level where so much of this policy and regulation gets set. And so we work collaboratively with them to help them understand what's coming, what fights to fight and which ones maybe to hold off on, and to provide resources so that they can be effective when we're thinking about state level mental health. So I'm excited to be here today. It's great to see all these individuals so invested in this space. And I'm looking forward to hearing from the rest of my panelists.
Wow, that's going to be really hard to follow up. But I'm Rihanna. I'm one of the youth panelists here. I am a senior in high school in Northern Virginia. And I think my role in this panel is honestly to just share about how youth are affected by, the mental health policies, specifically in the school environment. And when it comes to, digital technology in education, right? And so I'm just going to share a little bit about my experience directly with, implementing public policies and, kind of lobbying for policies that should support youth rather than enforce, top-down policies that we've been talking about, and instead starting from the ground up and from smaller levels to create larger scale impacts. And so part of this comes from my research that I did with George Mason University School of Social Sciences. And so part of this was taking over 300 interviews from students across NOVA, so across 3 different school districts, and getting their voices on how school policies in regards to whether it's tangible safety policies like metal detectors and SRO officers, and more like intangible policies such as how teachers are supposed to deal with, various situations regarding mental health. And through this, we've kind of gathered data about how these different policies regarding safety affect how students feel at school, their feelings of fear, and how they're able to focus on their, schoolwork, their education, or a lack thereof, because of the policies that are implemented by policymakers. And so through this panel, I hope to share how youth are directly impacted by all these policies. And in fact, they're the most important voices here because they are spending all of their time at schools, 8 hours a day, 5 days a week. And so I just hope to share how youth should be centered amongst all of these policies.
Hi, great. My name is Rachel Dean. I'm the Chief Executive Officer at Voices for Virginia's Children, and we are a statewide, nonpartisan, nonprofit policy advocacy organization. We're the state's only multi-issue child and youth policy advocacy organization, and I think we shine best at the intersection of so many of these issues. And I'm here to underscore the point that youth voice should be at the center of our policy discussions around youth well-being. I have a background as an attorney. I spent many years representing young people in the legal system, working on several campaigns around the state, including in Northern Virginia, to end the use of school policing, to end the use of extreme and exclusionary school discipline and to increase public school funding, and particularly in areas of student support. So adding more support staff, counselors, psychologists, social workers to our schools. Voices does a number of policy areas. We focus a great deal on economic mobility for families, really understanding that for many folks, the ability to thrive economically is the foundation of thriving everywhere else. Health equity, we work quite a bit in the child welfare system on foster care issues, and then very much in the space of youth mental health. We held a big conference last year on youth mental health. We at Voices have focused on in the last 10 years or so, bringing the idea of trauma-informed care into the public policy arena. And that is now evolving as we understand the limitations of trauma-informed care. We have started to embrace a model of healing-centered engagement that's been pioneered by Dr. Sean Ginwright out in California, and have started to introduce HCE. It is not a clinical approach. We are not clinicians. We're policy advocates, but we've started to embed some of that into the way we do advocacy and into the way we engage young people in advocacy.
So, wow, really tremendous experts here that I could spend the entire day talking to just myself. The reason I think I was selected to moderate this panel is because I come from a similar perspective as all of my esteemed colleagues up here. I began my career as a social worker and clinical social worker, and served as a mental health provider to children and adolescents and families in shelters, on mobile clinics, in their homes, all kinds of places. I then went to law school and became a social justice attorney, and actually fell into lobbying. It was never my pursuit, and yet I landed there. So for the last 20 years, I've been lobbying for children's health and mental health care. And it's been a fascinating 20 years indeed. I also teach here at UVA. I teach US mental health policy, US social policy, and I run a clinic where my students actually get a chance to work on these issues. So they get a hands-on experience, and I think bring a particularly important voice and perspective to the policy issues that we work on. So anyway, I want to get right to the panelists, but I do want to say that this is intended to be conversational. So we have tremendous people speaking on the panel. We have tremendous experts in the audience, and an exchange is the best way for us to, I think, move towards the goals of the symposium and what we all do on a day-to-day basis. But I will kick things off by asking our panelists, in my experience, policy is rarely proactive and is primarily reactive. And I think when it comes to the discussion today, what I have seen is that policy has been intended to really minimize the impact and usage of various digital platforms, because it's what we can do, right? We're not sure what to do positively yet, although there are examples of that. But what we know we can do is try and minimize access. We can try and minimize the types of platforms. We can minimize use in schools. So can you all speak to some of how you've seen that transpire over time, how public policy has attempted to mitigate some of the consequences we're seeing?
Happy to kick things off here. I think we should all remember, right? Like we exist in a country, right, that's beautiful and complicated at the same time, that requires our consistent engagement and participation to evolve progress and laws to that reach into all of our lives, right? So in order to make our lives better, our education system better, we have to show up with ideas and with the research and the data backing those ideas with our lawmakers. As someone who led K-12 education in the House of Representatives on the Committee on Education and Labor, Congress does not move without the will of the people. So, and I say this to say that over the past 5 years, right, like how many of us have been paying attention to Congress actually responding to the opioid crisis. Now, our country certainly had a chance to respond and learn from the crack epidemic, to respond in a public health manner, and we didn't. And there was a cost to pay for that. And Congress finally decides in 2018, October 2018, to come together to respond to the opioids crisis. In that bill was the first time ever grants created to support trauma-informed approaches in schools. 5 years later, so the will of the people, right? Like Congress, so there was an authorization, there was a bill that was passed that President Trump signed into law to provide $250 million over 5 years to support trauma-informed care in schools. Those grants were not funded until the bipartisan Safer Communities Act passed in June of 2022. That would not have happened if it were not for education groups and parents and youth serving organizations saying to lawmakers at the state level and at the federal level that these are the things that you need to pay attention to. We cannot foster belonging and welcoming and safe environments in schools without this particular approach. What you also saw in the Bipartisan Safer Communities Act, and granted, it was Congress responding to a school shooting, Uvalde, and that's often when Congress acts, right, like reactionary to the point they are saying. And what you saw Congress doing for the first time, so in March of 2021, the American Rescue Plan Act passes, unprecedented $122 billion investment in our education system. And then in June of 2022, with the Bipartisan Safer Communities Act, you see Congress invest $1 billion into mental health, specifically thinking about the fact that we have school districts in this country, many who have limited to no access to school-based mental health professionals. So there were two grants that were created, the school-based mental health demonstration grants to actually support the training of school-based mental health professionals. And then it created a pipeline. There was a school-based mental health grant to actually support the hiring of school counselors, school social workers, our school psychologists. And so there is a need now to continue on with those investments. What's happening, what ends up happening in the media are sound bites. There's all this conversation, and rightfully so, around the end of the American Rescue Plan Act, the end of these Bipartisan Safer Communities Act. And I think what needs to be interjected into the conversation is that this must be our new normal. It cannot be Congress acting only annually to appropriate these dollars, but how do you continue the investments in these programs? And also, what is the role of state and local governments, right? Like we're living during the time where the needs of students are so great, right? We're facing this youth mental health crisis at the same time where states are actually disinvesting in public education. And this has been happening, right? You can go walk all the way back to the Great Recession. So I say this to say that it requires an active participation in this democracy, right? From the local level, right? School district budgets, talking to your school boards around where to place those investments, and the state level to say that, yes, ARP is ending. Yes, these Bipartisan Safer Community Act grants are ending, but what is the role of the state, right? States have a constitutional obligation to provide public education to students. And how are they honoring that? Through the support services that students need, when many of them cannot access these services. And when they do, it's in schools. So we need to think about that infrastructure and the importance of continuing and sustaining these investments. And then at the federal level, you just cannot let up. I can tell you, as one of those staffers who did this work, that the top concern is all 50 million children are your kids. You feel very responsible for those kids. So there are bills that members are working on every day. Now, granted, only 2% of legislation that's introduced becomes law. And that's because, right, like it requires the will of the people. You have to have the politics behind it. You have to have the procedures behind it. But I assure you that when you actually have the will of the people pushing, right, members of Congress to state lawmakers to actually act, and you have those stories and you're lifting up youth voices, that is how you begin to move the needle and to sustain change. But it won't happen if conversations are simply limited to just these rooms. They have to take place beyond here.
I think in my space, what we see is we have a healthcare reimbursement model that is not geared towards innovation. So when you have innovative technologies, there is no pathway to pay for them within traditional healthcare. So the most effective types of digital treatments are really only available to those who can pay out of pocket, or maybe your family works for a very large employer and they've been able to curate through all the different apps and digital tools that we've been talking about to tell you the right ones, and then you can access them through that. That is the opposite of health equity, right? We have to be able to pay for these things within healthcare so that everybody can access them in a way that is affordable, or is at least hopefully more affordable. But when I have these conversations on the Hill or with CMS or with others, there's a real lack of understanding about what these even are, right? Everybody knows what an app is, but not all apps are created equal. And not all apps is what we're talking about here. We're talking about what are the scientifically evidence-based types of approaches that use digital tools to help get to people when they need it, where they need it. And people just don't understand. And then I think the other thing we run up against is that when we try to have CMS or the Hill or others create reimbursement pathways, you get a lot of pushback because they're worried about cost containment. They don't want new reimbursement codes because they're concerned that that will cost the government more money, that there'll be more spending on mental health. Now think about that. They want the mental health crisis to go away, but they don't want to spend more money on mental health. So that's the challenge that we're running up against in a lot of ways.
Yeah, just adding on to what Lakeisha said there about how policies can take place at both the federal level, but also the state level, and how important it is that there is that action on the state level. Recently, Governor Youngkin did pass the cell phone policy, where a lot of schools starting January 1st, 2025, schools have to enact some sort of cell phone policy where they, from bell to bell, students are not allowed to have their cell phones on them. And that can come in different forms of inaction, right? That can be either whether with putting your phones in your backpack or putting your phones in a lockbox that your teacher only has access to. Personally, in my school, we were one of the schools to pilot this program. And through this, we have had backlash from not only educators, but also students, which are the people that, you know, are affected by this policy. And in the educator perspective, not only do they have to enforce this policy when there are underpaid teachers, when they have, you know, actual lectures and school lessons to focus on, now they have a secondary thing to focus on, whether their students are, you know, using their phones in the classroom. And that is something that requires a lot of resources. And Governor Youngkin did fund, I believe, $500,000 for this initiative. And through that, he hoped to, you know, give resources to schools that or districts that are underfunded, but there requires some sort of local policy making, right? Whether that's with a school district where they're advocating for resources for schools that are specifically like Title I schools, for example. So that way we can have equity on all levels rather than having a standardized policy that isn't reflecting the different populations at different schools. And so I think that with public policy on all levels, there needs to be that taking in of youth voices and voices from different populations. Schools that are underfunded, schools that have minority populations, schools that have predominantly youth of color. Because we have stated several times in this conference that youth of color are predominantly affected by mental health illnesses, and specifically in the digital realm. And so with these voices, with this inclusion of not only stakeholders and educators, but also youth voices, we can help implement these policies and get the will of the people, get the will of youth, get the will of parents and stakeholders and educators, but specifically youth.
I endorse everything that was just shared. I think it's really wise. And so I want to talk a little bit about state level policymaking. At Voices, we do state level policymaking almost exclusively. We do meet with our congressional delegations sometimes to talk about federal spending and how it may impact us on the ground in Virginia. But so many of the issues that affect our young people today are issues that are really being decided, litigated, addressed at the state policy level. We've heard a lot about K-12 education. That is a state issue. There is no federal right to education for every child. It is enshrined in 50 different state constitutions and looks 50 different ways in terms of how states choose, as my colleague said, to actually honor that obligation they have for education. I want to go back to I was thinking through public policy and children, and when we start seeing public policy that is more geared toward the child or the young person, in recognition that that is a distinct developmental stage, and that children and youth are not just smaller adults with who can live up to the expectations of a grown adult in an adult brain, and really we start to see that around Reconstruction in the state constitutions of the southern states, who were required to add education amendments to their constitutions as a way to get back into the union, that there would be free public education for every child. We know, of course, that education was segregated and not equitable, but nevertheless, that kernel existed. And we see through the late 1800s into the 1900s, through World War II and into Lyndon Johnson's Great Society, a lot of lawmaking for the welfare, well-being of children. We see child labor laws. We see children's health insurance actually become a real thing. And we get then to kind of the 70s and the 80s, and there's a pullback. And I think we're kind of, in some ways still in that period now. There have been absolutely some strides made in the last few years. But as I see it, we are in some ways in our federalist system of laws and policies really back to like a pre-Reconstruction state by state system, wherein the rights and privileges one enjoys and the rights, privileges, and benefits that a young person may encounter in their life are determined on the state level based on the state they live in. That is, to me, legally, federally speaking, the unfortunate reality. So I'll talk a little bit about what that looks like in Virginia. We are fortunate that in the midst of crises and a TikTok lawsuit and all of the things swirling around, that youth mental health has become a priority of our gubernatorial administration, of our legislature. The problem, as several folks have alluded to, has been the sheer cost of addressing an issue on this scale. I agree with the panelists here that policy can be a bit of a blunt instrument. So, and it is reactive. So we hear, TikTok is bad and it's addictive and it was designed that way. So just ban it. Or cell phones can be disruptive. So ban them. We had the same responses after some of the school shooting tragedies over the last 10 years. This is a problem. Snitch apps. We're going to do snitch apps for everyone. Use an app, snitch on your friends. There's no nuanced threat assessment there. So it can be difficult to create policies to address the use of digital technology and mental health. That really get at prevention and that get at nuanced solutions that are grounded in reality. Nevertheless, I think there are some bright spots. There has been quite a bit of progress, slow progress, but progress nonetheless on school-based mental health in Virginia. There was a pilot program started maybe 2 or 3 years ago between our Department of Education and our state public mental health agency to explore expanding school-based mental health services in schools and how we could use state funding to leverage more innovative services and to leverage services from community providers to come into the school to deal with student mental health challenges. That money was not renewed in this past budget, but I think, let's talk about it, and maybe we'll see it in the upcoming budget as well. Crisis services, residential services, services really more toward the more just crisis-oriented end of the mental health care system are being supported and funded more. We are seeing a little bit of opening up in Medicaid regulations around telemental health services. There's so much more to do there, as my colleague mentioned. But I think we're onto something, and I really think there's some potential. There's also some possible pitfalls. But state government is really the room where it happens, and really the battleground we are playing on.
I'd just like to add something. So I know you mentioned that Virginia's prioritizing mental health as of right now, but last year Virginia was ranked 49th in youth mental health, which means that the phrase that reactive versus proactive has really been shown this year, because as a result of ranking 49th out of 50 states, that just shows how necessary it is, especially for Virginia, to have these policies, which I feel like the policies that have been enacted this year, such as the cell phone ban, have been a reactive policy, not necessarily with the data behind it, but rather, in response to a consensus amongst educators. But I feel like with more youth voices there, there has been some sort of change in how states and local governments, local school districts have been prioritizing, the cell phone ban. And I'd also like to touch on school-based mental health services, because they have been improving that. In my school specifically, there was an instance of gun violence where a freshman did die due to being shot last year by a former student. And so as a result of that instance, there was an influx of school psychologists that are supposed to be funded by the county that I live in. But the thing is, with the school psychologists, a lot of students mentioned that they had no clue that we had school psychologists, people who were licensed, people that they can access throughout the day for free, instead of, going online or using other resources, or not even seeking help for the mental health illnesses that they could have, or for the situations that they could be facing. So I think when it does come to mental health policies, there's also this issue of marketing these policies and informing students and educators that these policies and resources do exist. So I think that with public policy, there also comes an informative aspect to it, where we have to be informing school districts, students, and stakeholders that these policies do exist, so that the money isn't being wasted, that the resources aren't going unnoticed.
And making sure those services are really responsive to those specific communities. I live in a community, my kids attend public schools in a community where gun violence is the unfortunate day-to-day norm for our young people. And there has been a need identified for more credible messengers in mental health services, more culturally responsive services for those Black and Brown students, for students who are daily living the trauma of violence in communities.
So one of the things that I find particularly interesting about this dialogue is the fact that we're actually talking about youth mental health, and that we're talking about the utilization of schools as a site of service delivery. One of the first times I went to the Hill, and I won't say how long ago, but you can, look at me and just make your own guess. I was fighting for school-based health centers. And the first time I went to the Hill, I was told that I was creating federal nannyism, that's what that program would do. Because if you were a good parent, you would come to school and take your child to the doctor. We shouldn't have these things in schools. And for a whole host of reasons that you might guess, there was tremendous opposition. And now look at where we are, right? I mean, in 20 years, we've come to the point where we accept and we embrace and we invest in, first of all, children's mental health, which again, you just didn't talk about, and Congress didn't talk about in particular. It's a squishy science. They didn't have the data. There wasn't a way to give money and account for it. But now we're in this place where we are actually investing in it. And we are delivering these services where children are, the schools, primarily. Of course, there's lots of other mechanisms. Two other points I want to make very quickly, and that is that when we're looking at public policy, we have to bear in mind where policymakers are coming from, what they can do and what they can't do. And it's very different between looking at a legislative body and looking at an administration, looking at laws and looking at regulations, looking at something that is actually quite vague, even though there's billions of words contained in it, right? And then the influence that regulators have to draw that down into what will regulate that money. 988 was something that we poured a ton of money into. I mean, it was just consumed all the air in the room for mental health discussions, at least on the Hill, for quite some time, and all the advocacy organizations and all of that. And I'm not suggesting that it isn't a good service, but I do question to what end. And I do question, how do we spend that much time and energy diversifying the mechanisms that we could use based on the digital environment we find ourselves in? Where might we be today? One of the things that I think has probably been the greatest benefit to advocacy for policy is Zoom. Over the course of time, over the pandemic, it became the norm. It was embraced by policymakers as a mechanism to continue to talk to their constituents and to have conversations across the government. What it has meant for me as an advocate is I can diversify the voices that are being heard by those policymakers. It's no longer, again, from my perspective, that you have to be in DC to advocate. You can be in Nebraska, you can be in California, you can be wherever. You don't have to be an adult who can fly alone to DC, get a hotel room, right? You can be youth. You can be people with disabilities, children with disabilities. Their parents couldn't necessarily travel, right? So now we have Zoom. And I think from an advocacy standpoint, trying to influence public policy, you can get staffers on a Zoom meeting. And the amount of people and the voices that you can bring to that are limitless. So to me, if we're talking about the digital age, thinking about just that platform that can be used for advocacy, I think is a tremendous step forward. I think we've talked a lot about many different things, the pitfalls, the strengths of the digital age in referencing children's mental health and youth mental health. And I guess at this point, what I would love to do is open it up to some questions in the time that we have left for these tremendous experts. So we can begin to take questions from the chat and from the room. We have somebody who's going to go around with a microphone. Don't be shy. Raise your hand. There you go.
Thank you. I really appreciate hearing from all of you. I study education policy, particularly youth engagement and policy development surrounding mental health and well-being in schools. So this is my jam, and I'm just so excited to be here with all of you. Something that I've noticed about spaces that we engage in with youth when we're trying to develop policies that best serve youth is that often the youth in those spaces are students that school is working well for. And I'm wondering if y'all could talk a little bit about how we can use digital tools like Zoom to engage students that might be experiencing that exclusionary discipline or not super high achieving and looking to add more extracurriculars to their resume. So I'm really interested in hearing your perspectives on that.
I think that that's one of the greatest, right, like sort of outcomes, if you will, of the COVID-19 pandemic, right, is that it expanded access to lawmakers and staffers. I can tell you, like, as a staffer who was there, particularly during over the past 10 years and during those COVID years, the number of groups and particularly youth serving organizations who don't have funding to travel to Washington, D.C., were able to get Zoom meetings with staff and members of Congress. And that is still, Congress is still operating like that today. And that matters. It matters for multiple reasons. One, making sure that those voices, right, that are often unheard in the halls of Congress, that they are being illuminated. And I think even this week with the GAO producing the report around school pushout, particularly Black girls experiencing it at disproportionate levels, right? Like those were members of Congress. There were groups who went to members of Congress who advocated for more studies on this issue. And then those members of Congress went to GAO and said, hey, we need a study on this. And that's how that study came out. And now policies, and there are already policies around school discipline and addressing exclusionary discipline, but even more will come. And that wouldn't have happened if you didn't have those members listening to their constituents, many of them education groups and youth serving organizations. There's two other points I want to make here around the issue of access and the history and the laws that support us in engaging in this democratic process, right? My colleague walked us through an amazing walk of history, but I want us to remember that the federal role in education came as a result of the Civil Rights Act of 1964. It opened the door to the Elementary and Secondary Education Act and the Higher Education Act. And that is important for two reasons, because the federal government enshrines into law that its commitment to students is one of equity and opportunity and enforcing civil rights. And in 1954, with Brown v. Board of Education, one of the most profound things in that Supreme Court decision was the Supreme Court saying that in these days, it is doubtful that any child may be reasonably expected to succeed if denied an opportunity at an education. Such an opportunity where the state has taken to provide it is a right that must be available to all on equal terms. So that is the law in history that is at your backs when you are talking to legislators at the state level and honoring their constitutional obligation to students around what public education requires today and the context of mental health and the context of what is facing many of our low-income students of color, immigrant students. And then when you are talking to your federal lawmakers, right? So you can say we can make these arguments, but the history and the statute is there in terms of Congress's role here. And because of Congress's role, Congress has the ability to help move states along, right? Like we didn't get a Civil Rights Act because states decided, right, that they actually wanted to address the freedom of Black people. It was really Congress deciding that with the Civil Rights Act, right? Because states couldn't act. And so you have a federal government who has the ability to act, right, to determine state behavior. The federal government has acted in many cases around trauma and mental health. And so now it's a question of how can states leverage, right, groups, all the groups in this room, youth serving organizations in this room, how to leverage those actions, right, and that history and that funding as a part of your storytelling to tell fuller narratives when you're talking to lawmakers and to push them to go further. And it's going to take time to get there, right? Like policy making, it doesn't happen in a vacuum. It doesn't happen overnight, but you certainly can harness that history, that data, and those research to be a part of those conversations and the access that you certainly have now to push lawmakers to go further.
Can I expand on that question for our panelists as well? Just talking about equity, we've talked a lot about schools, but there are apps that are available. And I know a lot of my students talk in great detail about the usefulness and also the overwhelming number of apps that are aimed at their demographic, meaning their ages, for everything from yoga and wellness and meditation to offering psychodynamic psychotherapy. So can you just talk a little bit about your experience with using those apps? And I know we only have like 2 minutes left, but if I can just get you to talk about that type of digital platform for use in children's mental health and adolescence.
Yeah, so I think especially the apps that are most popular amongst youth nowadays, like Instagram, TikTok, Snapchat, a lot of those apps are not necessarily, marketed as educational apps or, apps targeted towards mental health. But a lot of it can help mental health and can help education, right? If you just want to relax, you can go on Instagram and like see what your friends are up to. But then that can also instill a sense of like imposter syndrome and have negative effects and repercussions in that sense, right? Because you have a form of comparison that's built there. So in that sense, social media and digital platforms can have a negative sort of outlook on youth mental health. But in like response to the question specifically about like educational resources and extracurriculars, there are a lot of apps out there that are focused on engaging students in not only the educational aspect, but also a post-secondary aspect, and kind of helping them to expand their professional, professional endeavors. Like me, myself, like LinkedIn and Indeed. I know with the fellow youth panelists, we've all connected with each other on LinkedIn, and also with like the people that I've met. LinkedIn has been a great source of seeing what other people are up to in the professional field to see how you can kind of envision your life in a sense, and that can have a very positive impact on someone's mental health, because with direction, with goals, you can see a future for yourself rather than a future where you're lost and sometimes no future at all. And so I think with platforms like LinkedIn and other engaging platforms like Kahoots and Quizlet, I'm sure all of you educators know those platforms because they're focused on engaging youth. And that also translates to mental health, because I know you want to focus on that. Because when a student knows that there's resources out there that are free, that are affordable, and targeted towards their demographic, they can see how they're included, and that can, give them a sense of community in a sense. So I hope that answered your question.
Yeah, no, it's fantastic. I think at this point, we're actually going to break up into groups. So, okay, great. Sorry, don't listen to me.
So at this time, I really have the pleasure to introduce Delegate Laura Jane Cohen and hear from a current lawmaker to react to some of the things that the policy panel talked about and talk about sort of what this looks like on a day-to-day basis. So Delegate Cohen represents Northern Virginia in the House of Delegates and is a passionate advocate for children and education.
Thank you all so much. I will say when I was invited to come here, I really thought, what expertise do I have to be able to impart on people who are really immersed in this every day? However, as the mom of a 17-year-old and a 19-year-old and former school board member and now current delegate in the House of Delegates, I thought I could probably give you 10 minutes. And I first want to take the opportunity to introduce my colleague, Delegate Ann Farrell-Tata, who represents the 99th District in Virginia Beach. Been here to learn, and I think to the panel's point, just another important piece of, how do you make good policy? And it's certainly making sure that you have relationships, that when last session we had 3,000 bills that came to us in 60 days. It's not possible to be an expert on everything. But if you know that you can pick up the phone and you have people who can give you guidance, if I know that I have a bill that it's not sitting right, that I can call Voices, or that they'll reach out to me. And I think, what you said about, and I want to give a little more context to the cell phone ban. That was an executive order from Governor Youngkin. So that has not gone through the legislature. We did have a bill last year that came through, passed the Senate and came to the House. And I think what you said is so important, because the reason that bill was not successful ultimately is that you have to be impeccable. That bill said that all cell phones would be banned and all communication devices. For any of you who work in the special ed space, you know what that means. I have no doubt that the person who put that bill in meant our smartwatches, and meant to do something that they thought was going to protect kids. But that's an example of what happens in policy if you are not having conversations with kids, with experts, with teachers, with administrators, to figure out what does this look like down the line. So I think one of the most important things when you think about policy, and somebody told me this a few years ago, and I use it every single time that I look at a bill or I'm working on legislation, is who does it help and who does it hurt? And I think more times than not, one of the reasons that I ran for the House of Delegates is that I felt like people are forgetting that second part. And that more often than not, the people it hurts are our kids, are our communities of color, are our disabled communities, our families, our folks who are in poverty, because they don't have a seat at the table. Nobody has included them in the policy conversations. And so the unintended consequences wind up being far worse than the good intentions of whatever that policymaker meant to do. And I would agree with you completely. I had the opportunity to spend spend 4 years on the Fairfax County School Board, and started January 1st, 2020. You might remember a couple months later that the world went to shit, and every policy, every idea that we had storyboarded and tried to manifest into being went into just survival. Some literal, some figurative, trying to help folks completely upend every way that we have taught you to teach, that we've taught you to talk to students. And I think that, as you said, some of the good in it, and I try so hard to take away what was good in it, is that opportunity to engage with people. I could not agree more. We're meeting on Zoom multiple times a day with every group that you could possibly imagine. And right now is the time. Our bills are due for pre-file November 18th. So even though we don't start until January 5th, these are the conversations right now that we have to be having if we're going to get legislation into this very short session. We have 45 days this time. And I think, one of the things that is really important to remember is what are those bureaucratic barriers? Somebody referenced it up here. When we look at, I think back to 9/11, and we look at that the tragedy was immense because no organization was able to talk to each other. We found out that Port Authority could not communicate with the firefighters. The firefighters and the police weren't sharing the same band because they were pulling firefighters from all over and police from all over. We found out that Homeland Security, which didn't exist at the time, but anybody who was involved in emergency relief and emergency disaster, they had no way to hear what was happening. And I think so often, certainly not on that scale, but more often than not, that is exactly what happens. To your point, something amazing happens on the federal government level, and all of this money comes trickling down for mental health supports. And if you asked a student at Lake Braddock High School with 5,400 kids in it, if they know who they're supposed to go to when they're in crisis, I will guarantee you that they don't. So our goal in the COVID times became, instead of really trying to focus academically, and plenty of people take issue with that, and they're welcome to, but was to really try to engage and make sure that every time you went in and you talked to a class of students, that you asked them, do you know one person in the building, one adult, that you could talk to if you needed them. And our goal was that by the time you graduated from Fairfax County High School, that you'd have 3 adults. 3 people that you knew no matter what would have your back. And they didn't have to have anything in common with you. I'll say one of my kids who's now at VCU, their person was a person from Galax, Virginia, who started the year and said to them, now, Finn, I've never known anybody with pronoun they, so I'm just going to call you Finn because I can't figure out how to do it. And I promise I'll do my best. And Finn was so moved by somebody saying, A, I might not be good at this, and B, I sure as hell am going to try. And that became their person. And when they finally graduated, I showed them a selfie that I had taken with their teacher, Mr. Bird. If you know him, you should. If you don't, he's this amazing human being. And when I showed my kid the picture, they said, that right there is the only reason that I'm walking across the stage today. So when we talk about the impact and we talk about what you do, whether it's research, whether it's policy, whether it's making sure that people know on the ground what they're supposed to know, all of those pieces, there is no way to do this job. There's no way to do my job if it is not for all of you. And so I think that we have this opportunity because I do agree that the local level is where it's at when we talk about best being able to protect our students. But student agency must be a piece of that. If you're going to talk about a student cell phone ban, you ought to be meeting not just with your student leadership group. You ought to be meeting with your GSA. You ought to be meeting with your Jewish student group. You ought to be meeting with your Muslim student group. You have got to make sure that the people who are not just engaging it in a positive way, but who are being so impacted in a negative way by it. The kids who are trolled on Instagram. The kids who an Instagram account is created for them and ruins their life at 16. Because that's how it feels, right? How many, raise your hand, God, do any of us remember like what it felt like to be 16? I do, it sucked. But raise your hand if you were turning 16 in a time when the entire world could know what you ate for breakfast. So how can we create policy about students without them? Because this is a reality, whether we're researchers, whether we're teachers, whether we're policymakers, that we have never been in. So with that, I want there to make sure that we are able to answer any more questions that you have. One thing I do want people to think about, and it's whether you're on one end of the political spectrum or not, is that what I have seen in the last 5 years, and COVID is a part of it, the polarization of our communities and politics is a part of it, but there has always been this pendulum, whether it's in education practices, education policy, just policy generally. But the swing over the last 5 years has been neck-breaking. We want kids to have every digital tool at their disposal, and then, holy shit, nobody told us that there was Pornhub. You know? We didn't know because we don't know how to log into our Instagram accounts because we're old, that Instagram can be a way that kids feel wonderful and that kids feel horrible. And that Meta and those platforms intentionally, like cigarette companies, made changes to their platforms to target and addict our students. So as the pendulum continues, cell phones, like, we love it. quick lash. We, try like every cool technique and every cool Quizlet and all of these awesome things that you can do in your classroom. And kids are really engaged and really excited. And then we're like, oh my God, we have stopped all engagement between and among kids. So let's take them all away. There has to be, and with your help, I think there can be, some way of slowing down that pendulum and finding something that is the right size. I don't know about you. I wish I could give you one example of the last time that a ban of anything worked. Prohibition. No gun-free school zones. Students, kids above or under 21 not being able to buy tobacco. We make rules, we make laws, we make policy, but we have to do something to really make sure we're getting the whole student, that we're getting the whole community. So with that, I wanted to ask a few questions of you all, if you will. How many of you are teachers, current teachers, former teachers, professors? Raise your hand. How many of you were ever students or current students? So when we talk about policy and we talk about the place to do it, I would argue to each of you that starting with your school board is the most important, because every one of us on the way to being whoever we are or maybe still going to be all went through there. And what we see in Virginia alone, a Commonwealth, to your point, that actively worked not to integrate their schools. In Fairfax County alone, did things like rename a high school, Robert E. Lee High School, and put a huge portrait as you walked in as a protest to make sure that every Black kid who walked through those doors knew that they did not belong there. We have a lot of work to do, even in what people consider around the Commonwealth as one of the most progressive areas. The work of undoing what was done, and then to your point, the work of trying to proactively make good policy. And we need your help. So give me, if you were coming to me, if you were coming to Delegate Farrell Tata, if you were coming to us, what would you say, gosh, I think that the Commonwealth of Virginia has got to work on this year. You got free reign. Don't be shy. There's no such thing as a dumb bill idea.
Thank you, Delegate. I think to me, this is one of the most important issues since day 1 and 2. We've talked about public policy, very important. We can enact, we can ratify, we can come up with all kinds of policies. You've mentioned it earlier on. If a policy is intended for me, do I know it exists? What are the barometers? What are the avenues we can use here as a takeaway to intensify that information? Where would Bekai go to access what that policy talked about? Earlier on, one of the panelists mentioned it. You also mentioned it. So what are the ways, maybe in your own capacity, if 1 or 2 policies are enacted, ratified, how would they get to the grassroots? What is the outreach that session would go across Virginia to say, hey, this is the policy, this is who is intended for, these are the beneficiaries, these are the ways and means you can access it. Earlier on, I think, as Irena mentioned it, psychologists, therapists at schools, do students know about it? You know, are they going to have assemblies to say, hey, this is the avenue for dissemination for you to know? So the question is, in your capacity with your colleagues, whatever policies comes in, how does it reach to the grassroots for those beneficiaries, and how could they access it? for their own benefit, individually, community, as a whole?
That's a great question. I think that this is one of the pieces to me, and I totally take off my Democrat hat, is to say that I think that people have got to demand of any of their policymakers is that you make a policy and I have to be able to hear about it. I want you to have a newsletter. I want you to have town halls, and I want them to be virtual, and I want some that are in person. I want you to host office hours. I want you to make sure that you're meeting with everybody down the line. So you come back from Richmond and you better be meeting with your board of supervisors and then your school board to say, these are the things that impact you. And then how are you going to communicate that to a broader group of people? And, you know, I think that's one of the best ways. Another way that on the school board, certainly I did, and I get to do less as a delegate, but I like to be able to do, is going into our actual schools. And don't go into the school and just meet with the leadership kids. Some schools do an amazing job of pulling in all kids from every different walk of life. But 9 out of 10 of them are the kids who, to your point, or whoever mentioned it, they are doing, school is working for them. Life is generally working for them. So go ask to talk to some students in the Cat B program and talk to their teachers. Go ask to just look at a lower level math class and just kind of hang out. Ask them what they're doing. Ask them what they like, what they don't. And ask them if they know, what are the questions that are important to us? Do you know somebody you could go to in your school if you needed help? If you needed to talk to somebody? So I think getting into the community, and, you know, for us, we do that any number of ways. I think everybody probably has a different feel for their community. Some people, they have really big churches that are important. They go and talk to the folks there. And then each of us in our own capacity. I think, honestly, like the scout groups have been some of the best. We have future business leaders. We have future farmers. Like, I try to go meet with our 4-H club. You know, I think we have a lot of different groups of kids who are working towards something better than maybe what they have, something better just for society. I look at the DECA students and I'm like, oh my God, like, look, I see smiles. How are you guys in DECA? Of course you are. So I think there are all these opportunities. And to your point, I think that the answer has to be, do you know this is something? And now that you do, who are you going to tell? And we need better ideas too. I mean, I think that I don't have a monopoly on good ideas about how to get that information out. So anything that you all think, if you say, come speak to our assisted living, come speak to, you know, the students in my class, like, we'll do it.
Can I ask a question?
Of course.
Okay. I'm a parent and I'm an IT professional for the last 20 years. So I have a couple of questions. First question is, how many of you in this room have binge watched Netflix? Okay, great. So after watching, how did you feel? Did you feel accomplished, very proud about yourself? Or what was your reaction? How did you feel about it? Yeah, you can do thumbs up, good, great, or you can say thumbs down. Yes, so I would give a definition for what is mental health. What is a negative mental health? I'll put it in that way. When the cell phones or the screen time is used excessively or for harmful purposes, it can cause a negative mental health. Okay, be it be Netflix, be it be kids, be it be apps, the social apps, or be it be shopping apps, Amazon. How many of us have been on Amazon for hours and hours? I personally have been on that. Okay, so now I would say my daughter is now 20 years old. Yeah. So 9 years ago, when she was a 6th grader, I asked one of her math teacher, can you just recommend one math textbook that I can work with my daughter. So the math teacher said, she was from FCPS. So she said, I have 101 links for you that you can give it to your kid and ask her to work. So my question over here is, currently, our education system is digital driven. Do you all agree? Right? How much time are our children working on the screens, not on these apps, but on doing the educational studies, right? So are there any policies around that? So,
Yeah, I think there's a lot of, this is again school board level, but I think a lot of school boards have tried to tackle it in different ways. I know in Fairfax, one of the big things that our board pushed for was something called Lightspeed, which is, and parents get to see what you were doing on your school issued laptop. There was no way to do that, which was insane. And I kept saying, like, it doesn't make any sense because Microsoft will send me at the end of a week, like, that, you know, my kid's been on YouTube for the last 27 hours. And so we were able to get that. So a big piece is, I think, has to be the cooperation with parents. And I think that's a big part of where policy can go wrong. And these guys could probably speak to it better than I can. But to your point, how much is too much? All of that, I think, depending on what grade you're in, what class you're in, what your age is. I mean, all of that is somewhat subjective. And if your kid is on 8 hours a day at school, but then they go home to completely unfettered access to any media, where's the role of the school and where's the role of the parent? And that has been in conflict, as you likely know, over the last few years. Where does the responsibility of the school end? Where does the responsibility of parents begin? And if you don't have someone at home who can help you monitor that, if you are the adult when you get home from school. So I don't know that they're hard and fast. These guys might know more than I do, but at least in Fairfax, I don't know that there's a good answer to that yet.
Thank you.
Thank you so much. Let me first say I just am so appreciative of your approach to this, of being so open to feedback and inviting questions in this way. To your question about, you know, what their priorities should be, obviously there's a million possible answers to that question, and it's an all of the above, which is impossible. But I would highlight that I think we are in the midst of an astonishing natural experiment right now. So within the state of Virginia and really across the country, as we look at things like the cell phone bans and things like that, there's, you know, remarkable variation. I have two kids at two different high schools, and already I see the variation in how some of this is being implemented in different ways. And so as we are in the midst of this natural experiment, you made what I believe is exactly the right point of course it needs to be iterated. It's not going to be the right form in whatever first try that happens. And we're looking for what are those middle grounds. And so I think there's such a priority to evaluate what's going on now effectively. And so that's where I would be really looking. And I think there's, you know, two pieces of it. One is, of course, getting all of those diverse voices and hearing about what are the impacts for these variations that are happening. What does that mean in terms of what's working, what's not working? How does it affect what happens outside of school, not only what's in school? And I think part of that is all of the listening that needs to happen with the different interested parties that you highlighted. And I think the other part is also setting us up to be able to evaluate this in the longer term. So for example, when I look at the, you know, state mental health assessments that are there. I happen to be an anxiety researcher. And we know that anxiety is like the largest category of mental health challenges that youth are facing. There is no question to evaluate the levels of anxiety among our youth right now at the state level to get systematic data so that we can then evaluate over time, how do we see this changing? We don't have the questions we need in there to understand, like, how much are you using devices, in what way, all the different impacts. So if we want to understand how these policies are being implemented, how we can figure out what parts are working, what parts aren't working, and how we need to change and evolve, we got to listen and we got to get good data, and we're not there. And we have such a window of opportunity here. This is the time to do that, to set us up so that we can actually figure out the answers to these questions. So that's where I would be prioritizing.
I think that's great. I think coming from, in my last life before I was a mom, I was a lobbyist on the Hill. And I think that's one thing that was such a shock coming to the state level, is that there is no reevaluation. There's nothing, not in any state. I asked a legislator the other day about a program that we have, G3. It's, a program where your loans are paid for if you're in some critical need areas for a certain period of time. And so I asked, it was his bill, I said, how's it working? And he said, I have no idea. I said, well, how would we know if we need to put more money into it, or if we need to change those fields, or if it's a communication issue? To your point, maybe people don't know that this exists and they can go into these fields. And he said, I don't know the answer. He's one of the smartest people I know. So I agree that I think we don't ever, school board, I would say this is universally true, of what happens is an election changes the body, and the policy changes to pretty much completely the opposite, with no evaluation, because it's just how people feel, right? You hear, you saw, you read that this was bad, so you get rid of it. So I think that's a big piece. I agree with you, and I don't know exactly. It is a passion of mine to figure out how we implement more of that. And is it just is it funding that is capped at a certain number of years, and then you have to have a reevaluation period? People don't like that. I understand. They want things that live long after them. But I agree, and it changes, right? Like, anxiety in itself is not one thing. How you ask about it matters. Fairfax County has a screener that, my kids would tell me all the time, like, it just didn't ask the right questions. And yet we take data from it, we make policy from it. But who's putting those questions on the screener? I'm guessing probably not the students. But I appreciate that point.
To add to your point, I would think it would be a great opportunity now to collaborate with CASEL. In my former state of North Carolina, we use CASEL to take data for SEL and try to figure out a way that you can launch a program to support the teens and the younger students, because anxiety is getting younger and younger. So if we have her right here, let's talk about it right now. So that's my challenge for you.
I love it. No, I think that's absolutely true. And I think the same, we, in Fairfax County, the way that we used a whole bunch of the COVID money that came was to finally have all of our systems use this multi-tiered systems of support. Many of you are probably familiar with it, and it's a CASEL program, not this CASEL, different CASEL, but of levels of intervention, and making sure that you're identifying kids earlier, and it can be across the board need. It doesn't matter if it's like a learning deficit where it's extra tutoring, or it's testing, or it can be emotional, it can be, all of those things, but to start at a level where your job is to know each student. And I think that we have a really long way to go there. I think I absolutely am a huge fan of making sure that people who know how to collect the data right are actually doing it. The Commonwealth of Virginia is not a big fan of that. And so I think that's something we have to change, because I do think we have structures. And again, it's like an election changes everything. You get a new governor, everybody in DOE leaves, and all of the expertise and institutional knowledge and the people who knew to reach out are gone. And it will change again, hopefully. Anne's not and Farrell's not here anymore, so I can say that. I think that you're right. We have to be able to identify experts who will collect that data so that good data makes good policy. Good data interpreted correctly makes good policy. Who else? I think we're supposed to be doing table things. I'm completely screwing up the whole format of this.
I think we have time for maybe one more comment, question.
I talked about student agencies and 0 students are asking any questions. I'm looking at you all.
I'll ask. Oh, no.
They were very active yesterday.
Just tired. And it's like no one's fed them.
Can I ask a quick question or make a quick point? As a mother of 3 children who go to public school, 2 of whom are done, no, 1 of whom is done, I lose count. I've been waiting for them to learn the government. And I make them read a manual that I wrote because when they're done with high school, they don't understand how, frankly, the local, state, and federal government work, and therefore how to engage in it. I find my students coming to college who are public policy majors, I'm still going over Mr. Bill on a Hill. I literally show them that video. And so my point is when we're thinking about engaging youth voices, which is critical, how do we use the systems in place, like the education system, to ensure, and it's probably improbable, but to make sure that they're getting those skill development opportunities in some way? Because the curriculum currently doesn't really offer it from what I can see.
Yeah, so I think your point on that the curriculum currently doesn't like offer proper education or like resources for government after, you know, you're an adult or after high school. I think especially with the mandate of government as, you know, a senior in high school or like civics in 8th grade, I think those classes definitely do teach you, I guess, on a more like formal level. But when it actually comes to duties that, you know, a community member, someone who doesn't necessarily have like a political leadership role, but still wants to have the active role in politics, because everyone, no matter what your role is, no matter, you know, whether you are like a delegate to the House of Delegates or, you know, just a regular person, there are, you know, ways that you can impact policy on all the levels. And I think that just speaks to federalism in a way, because when you break it down, right, when you break it down, even a normal person has the same impact that, you know, someone who's a political leader does, because the political leaders are getting their voices from people, community members. So I think just enforcing that or teaching students that, you know, regardless of what their position is, that their voice matters, and enforcing, you know, councils in high school and middle school so that they know that there are opportunities for them to speak. I know you mentioned that you have like a board of supervisors, for example. Those are people who are members of the community that might be, you know, professional or like skilled in a certain facet of, you know, whether it's IT, whether it's economy, and they help you make your decisions, right? So I think just teaching people that no matter what field that you go into, you still have an opportunity to make an impact with your voice and influence policy in that manner.
And I think, you know, there's always there's always danger, I would argue, of ever mandating curriculum at the state level. Because again, well-intentioned, the people passing it think this will be great. We will make sure that all schools have policies that everybody can use a bathroom that they're comfortable with. And what we're gonna do is have the Department of Education be the ones to do the model policy. That sounds great. When you had all Democrats in charge who then said, yeah, every school system needs to make sure that kids feel accommodated with whatever, whether it's privacy, whether it's just wanting to have access to a single bathroom. There's a spectrum, but yeah, let's do this. And then you have the whole DOE changeover again, and the policy becomes that, school teachers should be able to essentially ID kids for their gender before they walk in the bathroom. So, I worry. We had an awesome bill that students brought this year about adding environmental education curriculum. Such a cool bill. But who's deciding what that looks like? People who don't believe in climate change? That's going to look very different, I think, than the intention of what the students brought it. So I'm scared of mandating curriculum, even though we do have civics, we do have government, and there are certainly things that are to be covered. But I would argue too, like anyone out here who is a teacher, bring in your local government officials. We love it. And there are a lot of them who are nonpartisan if that is a concern. Bring in your board of supervisors, bring in your school board members. All of them have run on a nonpartisan ballot, even though they may well be Democrats or Republicans, if that's your fear. Or bring one of each, but let us come help you. I remember lesson planning. Let us have a day where you get to have a break. And then we get to say to students like, hey, walk me through how a bill becomes a law. And then I get to tell you all of the completely screwed up ways that you learn that are not remotely right. I majored in political science in college, and I walked into politics and I was like, I could have majored in Greek. I mean, I thought I knew everything. I knew nothing about how things really, really work, which is all back to relationships, to be honest. That's how a bill becomes a law. So, I think, yes, to your point, there's definitely work that can be done, and there's probably a way that we can be more helpful to that process in just making that curriculum come alive. Because you're right, I think my kids learned all of those things. And did you really feel prepared when you were walking through? You kind of have to do it.
Yeah, so my question was, for context, I'm also a high school student in Fairfax County. So a lot of the things you have been saying have been hitting home. And I go to a high school that has in a week in the last month has gone under lockdown 3 times in 1 week. And my mom has gotten cryptic emails. That's my mom right there, by the way. Shout out. She has gotten super cryptic emails from my principal saying there's a threat in the community. We need to take all the students out of the trailers and bring them inside. And it's we don't have access to that information because we're not getting our emails to our personal accounts. We only have our school emails, and we don't get updates through our school emails. And on top of that, my mom, she'll try to contact me and she's like, I just got this email. Are you okay? What's going on? Because I think those are very valid concerns for her to have, because we all like to think, oh, that would never happen to us. We see it in the news, but we don't want to accept that that could be a reality. So my question was, with the added anxiety of phones being taken away, is now that we've had time to see the ban being implemented, what is being done at the state level to reconcile the experiences of parents, teachers, and students when it comes to issues like this?
Yeah, I think that's an excellent point. And that's the number one thing that I hear in our community from parents about the cell phone ban. That's their only worry. They feel yeah, sure, gosh, we know. I don't want my kid on TikTok during civics class. Which is maybe why they come to you and they don't know how a bill becomes a law. But I don't want that, but I do want to be able to get in touch with my kid when there's an emergency. I do want to be able to reassure them. And the answer always given back is call the school. Back in my day, just call the school, and you know what? Back in my day, I never once was hiding under a desk because I was afraid for my life. Not once. So, you're right. How do you, at the state level, we haven't gotten together yet. The session starts in January. It's definitely something our caucuses will meet well before then. It's definitely something that I know myself, 3 of us from the Fairfax County School Board actually ran and won. At 2 delegates and 1 senator. So forget what you heard about how people hate school board members. It's not real. So I think we're bringing, and that's, I think, one thing I wanted to say too that I meant to say is that I would ask all of you when you leave here to Google the freshman class of the state, the House of Delegates this year. And it's the most amazing thing to be a part of. It is, all of us have a lot of very different and unique experiences. A lot of us come from families who really struggled to put food on the table. Some of us came from military experience. Some of us came from, some of the most amazing things that people have done. We have one person in Norfolk who's like a female Black aviator and scientist. And just like you're sitting there and you think, how do I get to be in this group? Talk about imposter syndrome. And I think one of the most important things when you talk about who you reach out to is so important. Who you elect is so important. And I think when you go to the state legislature, and if you could hear the kinds of bills and the kinds of things that we were talking about this year, it was so remarkably different. And so electing 3 school board members, and we happen to have one from here, Albemarle, who was elected, I think one from Charlottesville who was elected. There's several of us, and I think that brings a very different perspective of like, yes, and have you had to reach out to your kid and ask if they're okay and get answers back like, Mom, I'm near a window, so I think it will be fine. Mom, I'm on the 2nd floor and I'm really worried, but there's a really big closet in the back, and our chemistry teacher said that he will just get us all in there. We'll be just bodies on bodies smushed together, and he will hold the door. So, is it right to cut you off from that and cut you off from that information? Before the cell phone ban, we were talking about as a school board making sure that everybody had WhatsApp so that you could get those same communications that you weren't getting. So you could know, hey, everything's okay. This is just a precaution from what happened earlier, an Instagram threat. The police have investigated it. We feel very comfortable. However, we just want everybody to stay in the building. Very different than there's an active shooter outside the building that we've identified, right? 2 completely different responses in your heart and in your mind and in your legs. So I don't know the answer to that. I don't know how we do it well when now we've taken cell phones away from you. If you have ideas.
Well, this is such an important discussion, and I hate to cut it off, but really want to thank you, Delegate Cohen, and the panelists and everybody for